Hi, and welcome again to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the last video in this exercise program for the wrist exercise program number 2. This last video will show you how to perform a stretch into flexion, and I'll show you. So I want you to bring your arm up into this position. You're going to take your the hand or the palm and fingers of your good hand and place it on the back side of your painful wrist or hand, and you're going to push into flexion or in that direction, just like that. At this at this stage of recovery in the recovery process, you're probably able to give yourself a little more pressure. Just be a little more aggressive with that, and that's fine as long as it doesn't increase your wrist pain. So if you notice that when you started this particular stretch, that your pain seems to be increasing, then you might want to be a little less aggressive, or just hold off on that particular stretch right now and maybe add that in a few days or in a week. When you perform this stretch, I want you to hold it for about 10 seconds, and you only need to do 8 to 10 repetitions of that particular stretch. You can use that more than one time during the day, but one time is all that's really needed. If it feels good and it really helps with your motion, you can do that up to 2 times a day. Once you find that your motion in this direction or in any direction that you're stretching has returned to normal, then you can stop doing that particular stretch. And don't forget, one way to determine if your motion is normal or even nearing normal is just compare it to the other side. Hopefully you have a good side, and you can compare it to the other side. That's what's great about all this, is you always have most of you will have a good side to compare it to. That's what I tell my patients, and sometimes I have a patient that doesn't have a good side to compare it to, in less common instances. But if you have a good side, compare it to your good side when it's nearing normal or normal. Then you can determine how aggressive you need to be, or if you can stop that particular stretch altogether. So that's it for the wrist exercise program number 2. The great thing about all these videos is that if you have forgotten one of them, you can just click on that video and watch it again. My patients don't have that luxury because, I see them one day, I give them some exercises, and they have to, if they've forgotten something, they may have to wait till the next time they see me to know that they're doing that correctly, or even remember a certain exercise. So view the videos over and over again if you have to until you get it down right. Write them down on a piece of paper if you need to. Take that to work with you. Put that in your car. Put that on a table next to where you sit in the evening while you're watching TV, so it'll remind you to do the exercises. And hopefully you will find that you're on your way to feeling better and getting back to being able to use that hand and wrist like we need to on a daily basis